I'm Megan Osborne.
Miranda Chitwood. And I'm Kelsey Johnson.
And for our leadership project, we did an international student guide for international students coming to SCSU as nursing students. Please enjoy the show.
So this is a little bit about St. Cloud. The total area of it is 41.08 square miles. The Mississippi River runs through St. Cloud. It actually starts in Minnesota and it ends into the Gulf of Mexico. There's approximately a population of over 60,000, making Minnesota's 9th largest city. It is home to a number of historical homes. It is also home to the St. Cloud Hospital, which is a magnet hospital with a staff of over 4,000. St. Cloud State is the 3rd largest public university in Minnesota. The St. Cloud State University's mission statement is to prepare students for life, work, and citizenship in the 21st century. The St. Cloud State University's vision is through active discovery, applied knowledge, and a creative interaction, we positively transform our students and our communities where they live and work. The Department of Nursing Science was established in 2001. Each semester there are 40 students admitted, so that is fall and spring semester. There are also 24 RN to BSN online students admitted into each fall and spring semester. Approximately at any given time there are 200 students enrolled into the nursing program, and there are about 13 staff members and various skilled clinical mentors. The School in Health and Human Services prepares students to be leaders, scholars, and professionals in promoting and providing lifelong optimal health and wellness. It serves about 2,500 students, and the programs are collaborative and interdisciplinary and offer students a range of opportunities and community partnerships.
So some programs offered under the School of Health and Human Services are the following. So we have communication sciences and disorders, psychology, counseling, and family therapy, gerontology, kinesiology, medical laboratory science, as well as nuclear medicine technology, nursing, radiologic technology, and social work. This is the mission, vision, and core values of nursing. Our core values of nursing is service to the community, experience in teaching, scholarships and practice, professional and ethical behavior, lifelong learning, interdisciplinary innovation, and diversity. Our vision is we enhance the well-being of people and their communities through nationally recognized innovative programs, rigorous practical experience, and strong professional partnerships. Our mission is we prepare our students to be leaders, scholars, and professionals in promoting and providing lifelong optimal health and wellness. This is a little bit about our modern equipment here. So our human patient simulation lab allows our undergraduates to develop a comfort level with and knowledge of equipment and procedures they will need in professional settings. We have 5 simulated hospital rooms with auto-visual controls, a home care simulation room, and 19 hospital bed spaces. And we incorporate this equipment into our studies. So those are just kind of the following modern equipment we do have. Some pictures of people using it. Our EMR, or electronic medical record, is our patient data stored electronically. So we have data accessible between facilities, care everywhere. One of the examples would be an Epic. Syncable technology, blood glucose results sync automatically to computer through charting, assessments, LDA, interpersonal communication, as well as medication administration documentation, dual sign-off, and contraindications, red flags, lab results, and new orders. So those are all those different areas that goes through the EMR. Here's a nice picture of us in the simulations and in classroom.
This is the outlining of our program here at SCSU. In the first semester, they primarily focus on the basic clinical skills of bed making and nursing assistance and getting your basic nursing knowledge. The second semester focuses on our rigorous parts of the program where we go through intensive clinicals and work with patients throughout the weeks and prep on them the nights before. And then we eventually take each part of our program and combine them into a collaborative nursing core. Our certifications that we have to hold in order to maintain our clinical sites throughout SCSU, we have to have the BLS or CPR and AED certified, so that way we are able to rescue our patients or help them if they're in distress. We also go through a Red Cross disaster training, and public health certification is optional for students completing our program here at SCSU with the BSN degree. The Crisis Prevention Intervention, CPI, that's also a class that is offered when a lot of nurses get their jobs. And so that's a technique in de-escalation that various hospitals put through. Some clinical sites that we go through using these certifications and skills. Our clinical sites are mainly through the St. Cloud Hospital, but students also have the opportunity to go to Fairview, such as Northland Medical Center, Princeton, Fairview Northland Medical Center in Princeton. Other nursing homes such as Good Shepherd, St. Benedict's, Assumption Community, and Country Manor. We have a various amount of mental health sites where we go through the hospital and other outreach programs through the VA and other mental health institutions throughout the state. There's also a variety of wound care clinics, hospice houses, and home care visits that we also were able to maintain. Or your first step into obtaining a nursing career, most people go for their nursing assistant, which is helping with the basic skills in life and assisting nurses and working alongside them and doing the basic tasks that they may provide. Certified medical assistant, they may go to typically a one-year program where they're able to administer flu shots in certain clinics and work alongside nurses and other healthcare professionals underneath them. The licensed practical nurse, that'll be your skilled nurse, and so they do a lot with medication administration and IVs, and they work more with focused assessments, whereas a BSN, you will do full assessments and you work with research, and it's usually a 4-year degree for your BSN. Whereas your ADN is a 2-year clinical RN where you don't have the component of research and some other aspects for evidence-based practice as you do with a 4-year. But they're pretty close to the same degree, just not a lot of nurses are hired as often with a 2-year degree, which is a little different than how it is in South Africa. So, an advanced practice nurse, you can go on, and that's 2 or 3-year program on top of your BSN education where you can specialize in a certain area that you wish. And then you can also move on for doctoral programs in nursing and work in midwifery and assist and many others. So the scope of practice for the various different levels of nursing as a CMA or a certified medical assistant, they prepare and administer medications as directed by the physician, and they can assist in gathering patient information. The licensed practical nurse is able to administer medications as well. They can perform focused assessments and assist in plan of care. The associate's degree nurse, so the 2-year RN degree, they can perform a full assessment, educate, plan care,
for patients using critical thinking. And then with the Bachelor's of Science in Nursing, the 4-year degree, it's the same as the ADN, so they do all the full assessments, educate, plan care, but they can go a little bit further with options for management, medical, personnel scheduling, administration, and leadership and research roles. With the Master's of Science in Nursing, they can practice independent. There's the nurse anesthetist, which works with an anesthesiologist, the midwife, and clinical nurse specialist, and a nurse practitioner. So just a little bit more about their education. The 4-year, it's at a university or technical college. You can apply after with the high school degree, and then usually 2 years of prerequisites. For the St. Cloud State, you have to take a HESI entrance exam and then have a GPA higher than 2.5. And then that's a 4-year degree, and you would have your BSN with that. The associate's degree is at a university and technical college as well. You would need your high school diploma, and then you would do the HESI entrance exam with a GPA higher than 2.5, and then that's a 2-year or your RN. Certificates, you would have your high school diploma, PSCO, and then you can get it through your place of employment or a technical college. You can start out at grade 11 schooling. It's 4 weeks to 1 year, and then they have job or on-site training, and that would be a CNA or a PCA, so an assistant to the nurses. The postgraduate degree, you would get a university graduate program. It's the BSN. You would have to have your BSN to apply, and then it's additional 2 to 3 years for the program, and then that would lead to the advanced practice nurse, the midwife, the CNS, or the nurse practitioner. In the state of Minnesota, the programs available for an LPN there's 26 programs available. For the nursing or the 2-year nursing degree, there's 28 programs, and then with 6 offering LPN to RN degrees. So a person who had an LPN prior, they could get their RN degree. And then 19 programs for BSN and 3 programs for their master's. Within St. Cloud State University, we offer the BSN program, the 4-year-long program. So you would do 1.5 to 2 years of generals prior to applying to the program. Then once you get accepted, it's a 2.5-year program. We also have the RN to BSN program, which you would have to have your 2-year RN degree prior, and then it would be 2 years to obtain that BSN degree.
Nurse Practice Act of Minnesota. It was amended to revise the definitions of professional and practical nursing, and some of the changes were based on the assessments of what an LPN and an RN can do. The Nurse Practice Act was enacted to improve patient safety by defining the scope and practice of licensed practical nurses and registered nurses. The practice statements are shown side-by-side format to assist in comparing between the United States and South Africa. And here is a copy of that Nurse Practice Act, if you would like to take a look. And here are the major differences within the bachelor's trained nurses between the United States and South Africa. We are trained basically in the general nursing, psychiatric, and community. Over in South Africa, they have an additional part of midwifery. When they graduate, they do know how to deliver babies, and it's not a separate degree for them. We can collaborate and coordinate with doctors and other nurses to advise on what we feel would best help the patient. The nurses in South Africa can actually diagnose, and they can treat and write prescriptions. We can implement interventions. Again, like I said, in South Africa, they can prescribe. when they feel necessary. We provide health promotion, disease prevention, care coordination, and case finding. And in South Africa, the prevention of disease and promotion of family and health planning by teaching to and counseling with individuals and groups of persons. We can assist the midwife or the physician. The nurses in South Africa actually perform the delivery of babies. And the nurses here don't do episiotomies or midwifery. Again, in South Africa they do that. So the main difference is within the delivery of babies. Along with this slide, Jane does have safety tips, points of contact, and fun things to do for students visiting St. Cloud State. Thank you.